Hi, I'm Dr. Joe Lazar, and I'm one of the 21 board-certified dermatologists at Dermatology Consultants. At Dermatology Consultants, we take great pride in taking care of people's skin. Every day, I'm approached by patients who have questions about things that they've seen online, oftentimes misconceptions about skincare and how to keep their skin healthy. And so I wanted to take a little bit of time to address some of these misconceptions that I've come across during my patient care. Here's myth number one. It's a good idea to build a base tan. Unfortunately, definitely a myth. When you get a tan, it's a sign of sun damage. When our skin is exposed to sunlight, we have these cells called melanocytes that produce this pigment called melanin in a vain attempt to try and prevent further sun damage. So by the time you see that pigment, it's already too late. Damage has been done. Myth number two. If it's cloudy outside or winter, you don't need your sunscreen. Unfortunately, this is also a myth. While the clouds prevent some sunlight from coming through, they don't protect you from the ultraviolet rays, which are actually what damage your skin and can increase your risk of skin cancer. So even on a cloudy day, even during the winter, your skin is still potentially being exposed to these damaging ultraviolet rays. That's why I tell all of my patients to put on a daily lotion that has an SPF 30 or higher throughout the year. Put it on particularly on your face, your ears, your neck, back of the hands. It will give you great protection. Myth number three, car windows protect us from sun damage. A common myth is that if you're just driving about, you're not going to get a lot of sun through the car windows. Unfortunately, this is also a myth. The front windshields protect us from most sunlight. They still let some sunlight through, but the side windows are made through this process called tempering, and tempered glass doesn't block ultraviolet A light, UVA light, which can still cause sun damage and skin aging. That's why we in clinic see so many more skin cancers on the driver's side portions of the face and arms. So, if you're driving, the glass is not protecting you. You should still be wearing sunscreen. Myth number four. SPF 100 sunscreen is twice as effective as SPF 50. Unfortunately, SPF 100 is not twice as effective as SPF 50. It's a little bit better, but not twice. SPF 100 will block about 99% of the ultraviolet rays, which can damage your skin and cause skin cancer. SPF 50 blocks about 98%. Once you are at an SPF level of 30 in your sunscreen, you're blocking about 97% of the ultraviolet light that can damage your skin, which for most people, that's what I recommend, SPF 30 or higher. Myth number five, dermatologists only treat cosmetic conditions. We treat a whole lot more than just cosmetic conditions. We treat acne, we treat warts, we do a lot of skin cancer screening checks. And if we do find a skin cancer, we can treat it with either surgery or even a specialized surgical technique called Mohs surgery. We also deal with other more complicated conditions of the skin, including autoimmune skin conditions such as lupus, scleroderma, and dermatomyositis. While rare, we go through extensive training in these rare conditions so that we can help people with comprehensive skincare. I hope I've cleared up a few of the skin myths that you may have come across. Takeaway points, it's a good idea to wear sunscreen every single day. Make sure it's at least an SPF 30 or higher. And you can get that in a lot of the lotions that you can find over the counter. It's always good to see your board-certified dermatologist if you have any concerns about your skin. That mole's looking funny, you have a new mole, things are changing, or if you have concerns about acne, warts, or any of those other things that I talked about, we're always happy to see you. But as a good rule of thumb, you should probably be seen once a year for just a quick head to toe, make sure nothing else is amiss.